IPF is a devastating diagnosis to receive. Processing information, adapting, and coping with changes may be a long and arduous journey for many patients and their families. Therefore, the physicians must adopt a very sensitive, well-paced approach to discussions regarding diagnoses, its implications, prognosis, treatment options, all the while taking cues from patients and their families on how to structure these discussions in clinical practice. In this presentation, we will be discussing about developing action plans in IPF. Once routine IPF care issues are addressed, it is important to identify patient needs and develop action plans for disease, symptom management, and what to do and what to expect and how to prepare for future, which is covered within advanced care planning. The purpose of an action plan is to empower patients to facilitate self-management. They need to know what to do and who to call for help and advice when outside of clinics. For example, when prescribing anti-fibrotic therapies, clinicians should take time to set correct expectations, discuss adverse effects, and provide recommendations to help prevent and mitigate gastrointestinal and skin-related adverse events. Simple instructions such as taking medications with meals, avoiding sun exposure, wearing protective clothing, applying broad-spectrum sunscreen, etc. can be included in written instructions. Providing patients with strategies such as reducing the dose or stopping the drug or slowly escalating the dose when restarting therapies are all useful strategies when provided in written instruction format. In addition, patients should be provided with contact number for a clinic nurse or any other team member who can help them troubleshoot problems in between clinic appointments. Another example for a symptom-based action plan can be a dyspnea crisis action plan. For example, when you become dyspneic, you need to slow down, pace yourself, or stop doing the activity as needed. Patients can also be instructed to ensure adequate oxygen flows. For example, measuring saturation and titrating the oxygen flow as needed. The need for different flow rates with rest and exertion is commonly unrecognized problem within ILD. Patients can be reminded to practice mindful breathing. If they have been prescribed short-acting opiates, patients can be instructed to take them when experiencing crisis episodes. This can very effectively dissipate crisis. They may also use inhaler therapy if they have concomitant obstructive airways disease. Finally, advanced care planning can be thought of as an action plan that helps patients understand what to expect in the future and how to prepare for it. It's a very important three-way communication process between the patient, caregivers, and the clinic teams that is often neglected in clinical practice. Therefore, it is essential that clinicians prioritize advanced care planning and allocate time for these discussions. Making a dedicated member of a team, such as the ILD nurse, responsible for these conversations may help in ensuring consistent and ongoing discussions with the patients. If the patients remain reluctant to engage in discussions, physicians should sensitively explore the reason for reluctance. Communication skills, much like any other clinical skill, can be developed through consistent practice. Physicians may also consider referral to palliative care experts in challenging cases to facilitate advanced care planning and symptom management. So here are some practical tips for developing appropriate action plans. Step 1 is to identify patient needs through systematic process of inquiry. Step 2, identified patient need should guide the development of action plan. Step 3, provide written instructions. Step 4, use plain and simple language. Step 5, provide education on how to use the action plans to both patients and caregivers in clinic. And finally, identify a point of contact for patients in case they need advice and support outside of clinic. This is a part of a series of 4 animated videos. Please check out the others.